Hello, ATG, and good afternoon once again. DrJay Alalade here at AsktheGynaecologist, and this evening is going to be a wonderful one. And unfortunately, I was not able to come up live yesterday. It was a busy one. But today, I want to ensure that I don't miss touch with your family to me now, and I always honor time that I spend online with everyone here. Once again, my name is Dr. Alalade at AsktheGynaecologist, and tonight I'll be talking about one special topic that I mentioned last week about cervical smear and cervical swabs. Definitely, we'll touch other areas as well, but this is the core of the discussion for today. I know it's a wonderful day, Saturday, April 10th, and we are all getting ready for the Owambe. Now, I want to say something before I forget. Now, you're aware that we're starting the ATG IVF Center June, July, okay? Now, spaces are getting filled up. People are calling to book and to get settled. I don't want you to be caught in late. If you need IVF, always call now. Monday morning, call the IVF Center and get booked. They'll give you a date and time. They'll tell you all the protocol. They'll give you all the cost and the price details, and you can get booked. And most importantly, especially, I want to say that the seminar for this month, April, okay, is on IVF. And by the grace of God, we're going to give discount for those that attend the seminar when they come for the IVF. So if you need IVF for any reason, you're supposed to attend the seminar April, okay? The seminar link for payment has already been published. Click on it and get registered for the IVF seminar coming up this April. By attending the seminar, you're going to get discount if you need IVF. Whether IUI, ICSI, IVF, you're going to get a special discount by attending the seminar. And it makes sense. You attend the seminar for $2,000. You're going for IVF, which costs millions or less, and you're going to get a huge discount just by attending that seminar. And the reason why I've said that is that by attending the seminar, it gives you more information and ensures that you get the best outcome for your IVF. So that is why I want you to come for the lecture. I want you to come for the seminar so that you can learn a lot in preparation for your IVF. Those that know data do what? Great things. The difference between you that has something and that other person that does not have is what you know, that knowledge gap. It's not just to know, but just also to put in action the things you know. So once again, I want to say get settled into that seminar and get registered for the seminar April today so that you don't miss any attraction and discount, huge discount that will be available for those that attend the seminar. And if you're watching on Instagram now, I can see Omoria Betty, wonderful lady. I can see Omojo Opoju, and thank you guys for coming up live. Omoria Betty, wonderful. Yvonne Dandy, Nwune Marcelo, and official Mrs. Bush, Unique Vicky, New Arrivals 1, Miss Tonye, and so on and so forth. And if you're watching me on Facebook here, if you're my Mercy Kende, Comfort Okpara, Esther Olatunde Osezwa, Idu Betty, Uhioma Hunoha, Chiamaka Amadi, and Akimbo BC Temitope Ajayi. Thank you guys for watching. I know people are already at Owambe and they cannot watch live now, but whenever you come up live, you can watch the video at your own free time. I'm definitely going to learn something. Now, I made a post recently, I think about 2 or 3 days ago, about thank you to Abeokuta. I made a post about cervical swabs and cervical smear. And people were a bit confused about it. And I said I'm going to explain today because people are concerned. What do you mean, doctor? Cervical swab, cervical test. What's the difference? There's a lot of difference between the two. They're entirely different. Can you comfort up? I can see you. And Ijeoma Merive. Thank you, Ijeoma. Agege, my wonderful, beautiful sister all the way from Nigeria. Ijeoma, thank you so much for being here. I really appreciate your presence here. Omon, Sweet, Blessing Williams, Franka, Nakenyi, Chiene, Yaden Comfort, Komilu Vicent, Chi Unwosu, Blessing Sally Okpaje. Thank you guys. And for our friends and wonderful, beautiful ladies watching me via Instagram, I say thank you so much for being here. I really appreciate you. And most importantly, I want to say I love you all. And honestly, When I say so, I mean it from the sincere bottom of my heart. I say to you, love you all. Now, let us start. Cervical swabs, cervical smear. Abisoye Asonye, welcome. Abisola Asonye, welcome. Chidera Ugwanyi, welcome. Now, Chichi Ulu, thank you so. God bless you. Monsora Jibola. So now, cervical smear, cervical swabs. Everything is taken from the vagina, from the cervix. Okay. Now, cervical swabs can come in 3 different types. We do cervical swabs to check for infection. That's all we do. And when we check for infection, we call it microscopy, culture, and sensitivity to see what organism is causing that infection or that foreign discharge in your vagina. We look at it under microscope. We do culture and sensitivity to grow the microorganism on a plate in the lab and to see which antibiotic is sensitive to treat that infection that you may have in your vagina. So cervical swabs is a broad term which we use to describe 3 specific swabs. The first one is the low vaginal swab, where you can just swab down below here. Whenever we are looking for GBS, group B streptococcus, that can cause infection in babies. GBS is a very, very funny bacteria and an infection causer agent, bacteria that can affect babies while they are being born. GBS is called group B streptococcus. It lives in the vagina. It hides in the lower vagina. So to check for GBS infection, we do lower vaginal swab in your vagina. Okay. To check for other infections like bacterial vaginosis, candida, we do high vaginal swab. So low vaginal swab, LVS, low vaginal swab, very, very close to your vaginal exit here. So you can do that to yourself. You just part the skin of your vagina, push in a swab there and swab that lower area. That is low vaginal swab. We use to check for GBS. You can also do high vaginal swab, okay, for bacterial vaginosis, trichomonas, and stuff like that, candida, yeast infection, high vaginal swab. And the last one is the endocervical swabs. We put that swab inside that hole in your cervix, okay? That one is used to check for chlamydia and gonorrhea. So your cervix, if you want to know cervix, put your finger, that's your middle finger, put it in your vagina. Go deep in, clean finger, wash it. Don't go and put finger that contains pepper or onions. Wash your finger clean. Omoria Obeti wants to join the seminar. Omoria Obeti, to join the seminar, one of our moderators will put up the link for the seminar here, and you can click and join the seminar, or send me a direct message on my messenger. Okay, Betty, thank you. So your vagina, put your finger in. Wash your finger though. Okay, don't go and put COVID or Koro in your vagina. I'm just joking. Anyway, no big deal. So put your finger in your vagina. At the top of the vagina, you feel a soft substance that's soft like the nose, like this. And that softness has a hole in there. That hole is the hole of the cervix, okay? So if you look at this, this my structure here, I don't know whether camera will do justice here. If you look at this vagina, that is the vagina, huh? That is the vagina, okay? That is the vagina, huh? That is where the penis goes, okay? As you look to the top of this vagina, you see that this structure here, this one here. See that one there? That one there? On Instagram, on Facebook, okay? That structure is the cervix, okay? It's like imagine the neck of the balloon. So if the womb is the balloon, that neck of the balloon is this cervix that open to allow baby to come out. The balloon opens, allows hair to come out. That opening is the cervix. It's like a hole. You put your finger in your vagina, you feel it there. It's soft. That is where your husband hits you when he's doing those heavy duty, wonderful work of God in the bedroom, in the altar of sacrifice. So that soft substance is a cervix, okay? When you look at the cervix, it's got a hole that leads as an entrance into the womb cavity. That hole is the hole of the cervix. We call that the endocervix, okay? Or the cervical horse. Don't worry about that, okay? But that hole, we take a swab there called endocervical swab, okay? And we check for gonorrhea and chlamydia and so on and so forth. So we have 3 swabs in the vagina, okay? Low vaginal, high vaginal, and endocervical swab, okay? That is for cervical swabs. It's used to check for infection and to know what antibiotics is better to treat that infection. We also do what we call cervical swabs. Cervical swabs, cervical smear. Cervical smear, okay, is designed specifically to pick up cells or particles on the cervix that could be a sign of a possible development of cancer on the cervix. So cervical smear test is a test designed, okay, to pick any possible sign of early cervical change that could be suggesting that that person may have cancer in future. Again, cervical smear test, okay, is done as a test, a screening test to pick up any changes or any sign of cancer or early cancer on your cervix, okay? And you should have that done every 3 years, as far as you are between age 25 to around 52 or 55, depending on your location, depending on the law in your locality. You should have that cervical smear every 3 years. That test, you also do it in conjunction with another test to check for what we call human papilloma virus. Human papilloma virus, HPV virus, is been known all over the world by research and consistent research statistically to be a virus that can live on the vagina for so long, and it can start to cause changes that will lead to cancer on your cervix. When we are taking swabs of for that, when we're taking some cervical smear test, we also test that smear for HPV virus. And if we find that you have HPV virus on your cervix, it could be a sign that we might need to treat you further. In most cases, if we don't see any HPV virus and your cervix looks okay, we'll bring you back in 3 years' time to check your cervix again. As far as you are sexually active, definitely you've been exposed to that HPV virus that can lead to cancer of the cervix. Any human being that is sexually active has been exposed at one point or the other. And once you're exposed to that virus, okay, it lives in your body forever, okay? It will only become obvious if you fall very, very sick, what we call immune depression, or if your cervix is not able to repair itself and this virus can now cause changes that can lead to cancer. So when we do cervical smear test, we are doing a test to pick up early changes, early cancer on your cervix. Cancer of the cervix is very notorious and it kills because it has a propensity to spread to the kidneys, because the kidney tubules called the urethra is very, very close to the cervix. The urethra runs on the side of the cervix there, and the cancer of cervix can spread to the urethra and block the urethra and damage the kidney, and it can kill people by causing kidney failure in a short space of time. That is why it's very essential for you, for ladies, to do cervical smear test. And if during your cervical smear test we find any suspicion of cancer on your cervix, what we need to do is to treat you as soon as possible, what we call colposcopy. Sometimes we take a small chunk away of your cervix and we treat that cervix to ensure that we've taken all the evidence or signs of precursor or origin or cells that could show that you could develop cancer on your cervix as soon as possible. We take it away. And if we do treatment on your cervix like that, we check you back again 6 months or 1 year down the line after that treatment to ensure that there's no further cells or further sign of cancer on your cervix. Cancer of the cervix is easily preventable as far as you have regular cervical smear. It's one of the most easily preventable tests. And this screening test, cervical smear, has been proven world over as a very reliable test to prevent, to pick up and to prevent signs of cervical cancer. I always tell people all the time, if you don't know, there are many hospitals out there that they do cervical smear tests now in Nigeria. However, if you don't know where to go to get your cervical smear test done, okay, what's that? You can always go to ATG Laboratories and we'll do your cervical smear test for you there. Affordable, cheap, easily done. If you don't know what cervical smear test is, or you've never had it before and you're over 25 and you're already sexually active, okay, you should get your cervical smear test done. We also have a vaccine, which is known, Cervarix, Gardasil. These vaccines are designed to prevent HPV infection in people that have never been exposed to sexual intercourse. If you're a youngster, you're watching me, very unlikely, but if you're a youngster, you're watching me, and you've never had sex before, you should get the vaccine, Gardasil or Cervarix, which will help to prevent you contracting HPV virus infection that could encroach into your cervix and start causing dangerous things that can lead to cancer of your cervix. I've seen people young as 26 have cancer of the cervix. I've seen people young as 26 never had baby before and have cancer of the cervix. I've seen people 35 years old, they've never done anything in their life, they are still virgin, they've have cancer of the cervix. Yes, people can get, even virgins, lesbians can get cancer of the cervix. If you've ever shared sex toys with somebody that is already sexually active with a male counterpart, you're at a risk of developing cancer of the cervix if you don't do your cervical smear test regularly. Nigeria has changed now. Nigeria is now very aware through campaign and awareness that people must do their cervical smear test to ensure that we pick up any sign on the cervix, to pick up any sign on their cervix that could be precursor or that could be a sign of possibility of developing cancer of the cervix. So you must not take this for granted. Now, before I go too far away, I'll take some quick questions on this Facebook. Because people want to ask questions and people don't want to be delayed. So I'll take some quick questions quickly and then we'll continue. Thank you, Elizabeth, for Gloria and for putting up our links for the laboratory. I got a question here from Frankai Nakenyi Chenye. Doctor, thank you and your team for all teachings and encouragement. After 3 years plus, I eventually got pregnant. And on my first trimester, please, what can I do I usually feel weak and dizzy? Thank you, Franca. The first thing you must do, Franca, is to check your blood. First of all, congratulations, most importantly. And I believe that congratulations is well in order for you, Franca. Well in order. And you've done very well. You've been following our ATG program. And I can tell you something. 90% of people trying to get pregnant, once they follow our program, within 6 months, they get pregnant. That is for sure. Statistically proven from Facebook. Case closed. And Franca, once again, back to you. Congratulations for that. And thank you so much. And God bless you. And God will keep your baby. You deliver safely by the grace of God. Now, if you've not been taking your folic acid before you get pregnant, now is the time to start taking folic acid at least 400 micrograms to 5 milligrams once a day consistently until you are 3 months into your pregnancy. Number 2, do a scan. Once you think about 6 weeks pregnant, do a scan to check that baby's heartbeat is there. It's paramount. It's important, not bargainable. Don't take it lightly. Don't take it jokingly. Just go do your ultrasound scan to ensure that baby's heartbeat is there. It's important. And also to ensure that baby is in the womb as we want it to be. What we call intrauterine pregnancy with a fetal heartbeat. Number 2, if you are known to have high blood pressure and you're having problem with your blood pressure, you should be on appropriate medication to prevent any escalation of your blood pressure. Number 3, you should be on aspirin 75 milligrams to 150 milligrams once a day to reduce the risk of preeclampsia and issues with placenta formation in early pregnancy. Those are what you should do. And most importantly, you should register for our antenatal group on Telegram. The antenatal group is being handled by Dr. Esther. So join the antenatal group for you to know more about how your body functions and what you should do during your pregnancy, all the way from cradle to delivery. From pregnancy to delivery. And God will bless you and see you through this journey. It's a wonderful journey, a journey that is full of grace and pleasure. God will be with you and support you, Franca, by the grace of God. Can they comfort of power? Our question here is that my cycle length is 30 days. When is my ovulation? I'm not going to answer that question. The reason is that once we start asking that kind of question, we'll start calculating and we'll turn this class into a mathematics class. I've given ample lectures and treatment and discussion and done and put at least 2 or 3 videos on our YouTube page to teach you about ovulation. My suggestion, first of all, Kehinde, is to go and watch my YouTube videos on ovulation. Our YouTube channel is already on our Facebook page here. Once you go to our channel on YouTube, you will see all the videos on ovulation. Just click one of them and watch it from beginning to the end. And you will know better. And you start lecturing your friends too in church or in the mosque how ovulation is being counted, okay? Thank you, my sister. Comfort too. If you have ovulation pains, there's possibility that you should get a scan done. Get a scan done to check your ovaries, that there's no cyst in your ovaries, and there's no endometriotic cyst. That's most important. Number 2, take some painkillers to help you with pain during your period. During your ovulation. Simple painkillers like paracetamol, diclofenac, ibuprofen, as far as you're not allergic to these medications or you got asthma. As far as you're not asthmatic, you should be fine using this medication. Jacinta Nweke is asking, can I get pregnant while on levothyroxine for hypothyroidism? Yes, you can get pregnant while on levothyroxine, but you must ensure you're taking your thyroid hormone medication regularly, consistently. And once you get pregnant, let your endocrinologist know so that they can optimize your medication and ensure that you're very okay. Nonye Marcelo, she's asking, doctor, is there any way to prevent ovarian cysts from recurring after surgery? I got a question here from Marcelo on Instagram. She's asking a question that, is there any way to prevent ovarian cysts from happening again after a surgery? No. One of the best ways is to put you on contraception, okay? But it's not proven to be very reliable. What we call combined contraceptive pill. But it's not proven to be very reliable in preventing cysts. So there's really no way anybody can actually prevent ovarian cysts, okay? If anybody say they can prevent ovarian cysts, that person, watch them. I don't think they know what they are doing. So there's really no way you can prevent ovarian cyst at all. What is it? If you find it, as fast as less than 4 centimeters, in most cases, it will disappear on its own. But if it's bigger than 5 centimeters and it's getting bigger after your next scan, when you repeat it in about 3-4 months' time, or if it's causing pain, then it should be considered to be removed. Someone's asking a question on Facebook. She says that my menses dropped from 4 days length to 3 days. Is it normal? That's fine. That's fine. A day change is not okay. It's not a big deal. Abeokuta Magic Lady, she say, what causes watery cervical mucus coming out with period? It's normal. What causes watery mucus coming out with period? It is hormonal balance, and it's normal. It's entirely normal. Thank you, my sister Shalewa, for posting the YouTube link on Instagram live here. Someone is asking, what would one do if your cervix is blocked? If your cervix is blocked, all we can do is we can dilate the cervix with dilators, okay? But blocked cervix is unlikely to cause infertility. But if we think that your cervix is stenosed, is very blocked, we can use dilator to unblock it if possible. Someone is asking, she wants to add Clomid as to supplement. No, I will not prescribe Clomid for anybody. The reason is that Clomid can destroy ovaries. If you're going to get Clomid, you must have follicular tracking and a doctor to be following you up. I will never tell you to go and take Clomid with your supplement blindly. No, I don't do guesswork. I dislike it. Doctor, can my cervical mucus during vaginal delivery? Can my cervix tear during vaginal delivery? It's possible. It's very, very rare. It's very, very rare for your cervix to tear during delivery. As far as your labor is well managed and you fully dilate before you start pushing, it's unlikely for your cervix to tear. Causes of tearing of cervix is when people push before they fully dilate. So your midwife should be able to examine you during labor to reassure you that you're fully dilated and let you know before you start pushing, okay? Doctor, what is the cause of period ceasing in a woman? Maybe your ovaries have stopped working. If your ovaries have stopped working, the periods will cease. If you got hypolactin, IFSH, you're overweight, you got PCOS, the periods can cease. Okay? Thank you, Bokwalala BC, Abiodun, Ammonia Green and Denyika. Thank you, Kendi. Loveline, Adamido. Signs of cervical cancer. You're seeing bleeding at sex. You're seeing offensive vaginal discharge, which you've treated and it's not going despite all antibiotics. I said again, you are seeing unexpected bleeding, okay? And you've never had cervical smear test before, and we examined you and we see some funny mass in your vagina. So irregular bleedings, bleeding after sex, unscheduled bleeding, pain in your lower abdomen. These are possible signs. Pain during bleeding during sex can be a sign of cervical cancer. Okay, bleeding during sex. Clomid, is it dangerous for men? Clomid is not for men. Blessing on ye. Clomid is not for men. Clomid is to make you ovulate. Men don't have ovary. What causes tubal blockage? Infection in your tube. Infection that was not treated, that was not properly treated, or that was missed and not treated. Infections that can cause the tubes, that there are ones that were not treated, not properly treated, or not even known, not treated at all. Some people, they have small discharge, they go and start antibiotics. Before you start antibiotics for any discharge in your vagina, always check that there's no infection there. Don't go and start swallowing poison. Okay? Thank you guys for being here today. I really appreciate you this Saturday. One thing I want to say is that I love you all. And when I say so, I mean it from the bottom of my heart. Don't forget to register for this April seminar. Don't forget. It's going to be wonderful. And it's going to be full of discounts for people that need IVF to attend the IVF Center, ATG Lagos, so they can get answers to their concerns and to their prayers by God's grace. Someone's asking a question: what causes men to trap? I don't know what you mean by mean to trap. I don't get that, Rashid. That I don't understand what it means. So, mean to trap. Thank you, everyone. God bless you. To see you soon. God bless you. Have a wonderful weekend.
The cat music.
When the building, ladies, ladies, FBI, Roy Keys, Father the Great. Kill.
Shabby, you want banger to banger. You can never top on spin all. Never top on bad.